Let's come to this now. The Eastern Cape plans to terminate the contracts of some COVID-19 healthcare workers, this by the end of March. The National Education, Health and Allied Workers Union says it is shocked. But for more, I'm joined by Nehawu's Eastern Cape Secretary, that's Mr. Miki Jaceni. Mr. Jaceni, thank you so much for your time. I mean, reading your press statement there, you're quite shocked, you're quite disappointed that these healthcare workers have to bear the brunt of this decision, thus losing their jobs quite in a matter of weeks, if I have to say so, because the end of March is quite near. Have you been given reasons as to why this decision was made?
Thank you, Tumelo and the viewers. We have been engaging the department for quite some time, trying to convince them that they cannot be unreasonable and be careless at this point in time to release the health care workers, because these are the contingent of soldiers that have managed to lower the curve of the pandemic in the Eastern Cape. So they have told us that, in fact, they have been pleading poverty all along. And they have been citing the medical legal claims that have brought the finances of this province down. So we just told them that it's not the justification for them to can release those health workers, because other provinces like the KwaZulu-Natal and also the Gauteng government have considered these people to say they cannot be careless and release them whilst the third wave is coming, and therefore we have been saying they must try and find money so that they can retain these workers.
Mrs. Jaceni, I mean, we've been talking about the issue of understaffing for quite a number of times here with your organization. Does this decision not exacerbate that?
Yes, Tumelo. In fact, what we are looking at, we have been listening to the budget speech by the MSc of Finance yesterday. Yes, he has tried to balance, but we have got mixed feelings, because you cannot subject yourself to the austerity measures and at the same time try to reduce what is already there, because the ratios that are within our government, especially in departments that are providing essential services, you may find that one person is doing the job for 5 people, because there has not been a recruitment drive. All the vacant funded posts have not been filled. So we are saying the people or the workers are taking a strain. Therefore, we cannot tolerate it. It's worse now that both departments of health and education are faced with this kind of situation where the budget will be reduced in the next financial years. So we cannot say we support that, because the job security is not there, the upward mobility of workers is not there. So I think the managers and also the MECs must act responsible and request that the intervention politically must be done.
Right.
We cannot be careless.
Well, I understand and know that you also welcome the appointment of the newly, seated and just appointed MEC of Health there, Nomakosazana Meth. You plan to have quite a fruitful relationship with her. You hope to engage with her quite speedily on this matter. What's your way forward in terms of engaging the new MEC of Health, but also in ensuring and assuring your members and some of the health workers that you are on the ball with regards to this matter so they don't lose their jobs?
No, definitely. We have been engaging even the acting MEC, Ngata, but also we welcome the appointment of the 3 MECs because they are females, and we hope that they've got the necessary skills, the requisite potential that is needed to take the department forward. But what we cannot do is to compromise our workers, because the patients are running very thin. And we are hopeful that there will be a political will for those that are coming in to take the department forward. Because definitely they must consider what is important to the people of the Eastern Cape. So you cannot take chances at this point in time.
We'll leave it there, but thank you so much for your time, Mr. Miki Jaceni from Nehawu.